Hey, welcome everybody, and welcome to the COVID-19 and our presentation on COVID-19 and children's mental health. This is a Houston conversation and a town hall. We live in a time where mental health is, for certainly all of us on this phone call, is increasingly important. Texas has lived through a number of hurricanes. We've lived through school shootings, and now we have this pandemic that's affecting everyone in the world, but certainly affecting us here in children. And historically, when we talk about mental health and children in the state of Texas, Texas has not done as well as many other states. As a matter of fact, I did an interview with the Houston Chronicle this morning where I talked about historically children in the state of Texas in terms of mental health funding have fared 49th in the country. And then after the tension of Hurricane Harvey and everything and a significant investment in mental health, we went from 49th to 49th. And so there's still a lot of work to do. And but I know that everyone on this panel has worked significantly on the issue of mental health at a little bit more as we move forward. So without any further ado, let me introduce those, our legislators on the panel. So first, I want to introduce our five legislators, five champions on mental health. Chairwoman Sophronia Thompson, District 141. She is the longest serving woman in the history of the Texas legislature. She's in her 24th term, 48 years. She started as a teenager, but has been a champion for mental health for all of those years. We're happy to welcome Chairwoman Sophronia Thompson. Also with us is Chairman Garnett Coleman. Garnett is District 147, serving since 1991, 29 years. Garnett, I think you also started as a teenager, if I'm not mistaken. And one of the things that we've always known about going to Chairman Coleman is that he can be counted on as a great advisor and champion in the area of mental health and children. So we're excited to welcome Chairman Garnett Coleman as well to our panel. Also with us, Chairwoman Sarah Davis, District 147, my district, Representative Davis, serving since 2010. And we love Chairwoman Sarah Davis because she's always there for mental health. I've also run into the chairwoman at our favorite Chinese food place. And so we're always excited to see her on a panel as well. Also, Vice Chairman Jean Wu, District 137. 8 years. Recently, as I followed Representative Wu on Twitter, I was excited to see that while all the grocery stores seem to have their shelves empty, Vice Chairman Wu said, "Hey, come to Asiatown. No one seems to be coming to the grocery stores here." So Vice Chairman Jean Wu, thank you for your service and thank you for all you do. And then Chairman Dade Phelan, District 121, out in East Texas, 5 years. Been in the state legislature. Recently, I was out with a class of graduate students, and I don't know if you remember this, Representative, but we visited and we talked about the aftermath of Hurricane Harvey with a group of graduate students, and Representative Phelan was happy to regale us with stories about hamburgers being served to first responders. So I know you remember that story. And we're excited to have you here. And Chairman Phelan has also been someone who's spoken up quite often in the issue of mental health. So without any further ado, I want to, first of all, welcome all of you for your service. Thank you all for what you're doing. I know the next legislative session will be talking about mental health a lot. So we hope that this isn't just the beginning, but a continuation of the work that we've done. And let me turn it over to Renee Vanya Tomczak. She's the president and CEO of Mental Health America, the host of this conference in association with Children at Risk and Legacy Community Health. Renee, thanks for all you're doing, and take it away.
Thanks, Bob, and thanks to you, Children at Risk, and also Legacy for their cooperation and collaboration around mental health. On behalf of vulnerable Houstonians, I want to thank the mental health champions joining us today. Our moderator for today is the esteemed Dr. Sim Shaw. Dr. Shaw serves as board chair at Mental Health America of Greater Houston. He is the executive vice chair and professor of psychiatry, family, and community medicine at Baylor College. And he also serves as chief of psychiatry for Ben Taub Hospital Harris Health System. Dr. Shaw has many credentials. He is also Chief of the Division of Community Psychiatry and the Director of Mood Disorder Research Program at Ben Taub Hospital. And he also serves as the Director of the Community Behavioral Health Program at Harris Health, which is an integrated care program. Welcome, Dr. Shaw. We're excited to have you moderate today. And thank you all, because we know there is no health without mental health.
Thank you. This is a very good topic, and this is a very esteemed panel. COVID-19 or coronavirus is a situation which we all are facing. Started last year. Right now we have about 227,000 cases which are positive across our country, over 5,300 deaths so far, and unfortunately it is increasing every day. Yesterday was one of the deadliest days, but that is changing and increasing every year, which is very sad. Texas is somehow so far better. Knock on wood, it continues to be better. We have about 4,500 positive and so far 68 deaths, which is better than other places, but still it's significant and we need to contain that. As a healthcare professional, as a first responder, I work in the emergency room myself. There are numerous challenges I see and all the first responders see. And when we think about any stress or trauma, I always think about 4 groups of people because they are affected the worst. The first is people who have mental health illness or substance use. Anytime there is any stress, whether it was Harvey, whether it was Katrina before, these are the people who are affected the first. The reason we know that is that there were studies to show that after Katrina, people had PTSD, depression, even 4 years post. After Harvey, we are currently doing a study. I was at NRG, we set up the camp at the Georgia Brown. We are seeing patients even 2 years post Harvey and plus, so that continues. Also, we know that the second group is kids, and that's the reason we're talking about children. Children are very vulnerable, and unfortunately, giving a lot of media coverage to kids does not help, and we can talk about it as we go, but that's the second vulnerable population. The third vulnerable population is us, first responders, because we are right there. We see people who are COVID positive. We see people who are PUIs, or person under investigation. We may or may not have the right personal protective equipment because the requirements, the recommendation change as it goes. It used to be that we don't have to wear surgical masks. Now we have to wear surgical masks in the ER. Everything is changing. Things are fluid. So there's a lot of sense of fear, insecurity, and a lot of panic. And while the disease is huge right now, what we are seeing is panic is becoming bigger than the disease. And having said that, it is not easy to handle this panic. Only thing I would say is that we all need to reduce our media intake, and maybe the TV media, which is a lot of social media in the sense that it has emotional content. If somebody is sensitive, they need to limit their emotional content media, which is really the TV media. Print media or reading is much better. What we're seeing in our population, we have a couple of hotlines. We have a hotline through Harris Center. We have a hotline through Harris Health to help these patients. We have started support group for our staff at Harris Health and Baylor. We have started support group for faculty, staff, or learners because that is absolutely needed. In addition to that, as of yesterday, we are going to provide care to our homeless population in Houston, because city and county are acquiring 2 buildings, 2 hotels, and converting it to some help for homeless population, and we will be providing mental health care to that population. So there are a lot of things we are doing. We did that during Katrina, we did that during Harvey. We want to help now again and do what we have to. But again, the task is enormous, the challenges are enormous, and it is not easy to ask people to come to work when there is so much threat around. I myself was a victim of that. I had testing 2 days ago, and gladly it came back negative. But I know it is not easy to be quarantined when you have to be quarantined. And so it's a tough time, but we have to do what we have to do. I would like to introduce at this time Dr. Triandra Gordon, who is the Clinical Director of Legacy Community Health School-Based Mental Health Program, and she will give us her thoughts on COVID-19 and the student population. Dr. Gordon?
Good morning, everyone. My name is Dr. Triandra Gordon. I'm the Senior Director of School-Based Behavioral Health, as was mentioned. I currently oversee 23 therapists that provide school-based therapy at 21 schools across the Houston area. Legacy, as one of the largest, as the state's largest federally qualified health center, offer services to all who need it, regardless of the ability to pay. We continue to see patients during this COVID-19 crisis. In fact, we've enabled 14 of our clinics to have COVID-19 testing capabilities. To maintain social distancing, many of our service lines are moving towards telemedicine, especially for our school-based clinics, which all 21 of those are closed due to the school closures. So starting last Tuesday, my team of therapists started doing teletherapy with families across the Houston area. Just yesterday, we began offering remote pediatric appointments, including for pediatric behavioral health, through our new virtual pediatric clinic. So we're finding that many people don't want to leave the house, especially parents of children who are immunosuppressed or otherwise vulnerable, and telehealth has been a very effective option. So what have we seen? We found that many students, I surveyed my team of therapists to really, because I wanted to know, from their firsthand experience, what are they seeing across the board in Houston. Many of the students that we were seeing that were dealing with anxiety, that has actually lessened, because a lot of that anxiety is often associated with social stressors, and so that has lessened during this time, especially, and that anxiety has also been associated with academic stressors, so that has been lessened. But high school students have concerns about credits, about promotion, about graduation. Many students are missing their peers. They report conflict within families, but are overall feeling safe from the virus due to being isolated in their homes. These are, of course, generalities because each family's experience is unique. We've also talked to parents who are feeling anxious due to their inability to work and worries about filing for unemployment. The strengths and challenges of each family vary, but overall families have expressed gratitude that our therapists are reaching out, that they're able to continue to provide therapy services through this time. We're able to connect with students in a new way. We get to meet pets, meet siblings, see favorite toys, have more sustained parental involvement. So both our therapists and our patients are adjusting to this new normal and seeking to find that source of hope, the silver lining in all of this. All in all, we're seeing that telehealth has proven to be a great alternative to regular face-to-face visits during this time when it's truly needed the most. And now I would like to introduce Chairman Coleman, who has been an advocate for school-based mental health for many years.
I want to thank all the sponsors of this call through video. These are very, as they say, trying times, but I know we have the resiliency to get through this with the least amount of challenges to our people in this region.
Chairman Coleman, what do you think, how the Houstonians are being affected by this, and how are they doing? What are you hearing from students and others?
Well, I think people are doing the best they can. It depends on the circumstance of the individual. If someone is fearful for losing their job, or if they're a worker, say, in the food service industry, clearly they have more stress and anxiety than the rest of us, and that means stress and anxiety for their families. And that's what we're hearing. We're seeing an uptick, of course, in applications for unemployment, and I think that is causing a family dynamic that certainly has an impact on children. Also, just the disruption of daily lives of going to school, not going to school, parents who can and can't be home with their children, and that daily dynamic of cabin fever. Not being able to get in and out and do the things that they normally do. But as we have been with other disasters, people are taking it in stride, and our leaders are doing the right thing by asking us to stay home and distance ourselves from each other so that we slow the spread of the virus.
I'm going to ask the next question. Vice Chair Jean Wu, you have been involved with Houston and other areas. What do you think, what is the response in our Asian American population, especially the ones in those areas, and also with some juvenile detainees? Do you have any input on that?
So this is an unusual time for everyone. It's difficult for all communities, but it's kind of unusual for people in the Asian American community, especially those of us who identify as East Asian or Chinese, Vietnamese, Koreans, Japanese. I think because there's been a society-wide blame put on Asians for this, because this virus came out of China, and with a lot of people taking very hostile actions against Asian American community. It's not so much happening in Houston as much as other places. I know that there are a lot of incidences that happened in New York, in Chicago, in San Francisco. Houston, I think, has been spared from a lot of it. Just we live in a city that's maybe a little more tolerant because we have to live with more people, and we're a bit more diverse. And I think we're seeing that in the way the community is reacting to it is to try to be as charitable as possible. And if you have seen the news in Houston, at least, the Asian American community has gone to great lengths to make, for the local organizations to buy up medical supplies and donate them. Yesterday, a whole bunch of organizations together and purchased 30,000 masks, an entire truckload of masks and other supplies, and donated them to a local hospital. And it's everyone feels it in a different way. I think community it feels a little bit under attack, but we're going to get through this. In terms of juveniles, that's a much more difficult issue. Right now in Harris County, there are about 150 kids remaining in local detention, and there are about in the high hundreds of kids in state jail and state prison for juveniles. Now, that's not huge population in comparison to adults, but it's still significant. The one big difference, especially for kids who are locked up, is they can't go home unless they have a family there, unless they have family to come. If you want to release an adult, you just release an adult. They just go somewhere else. For kids, they can't go home until a parent gets them. And this makes it especially difficult because you have many kids who have families who can't come get them, or are scared to come get them, or have other issues. And so you have children who feel unwanted because their parents are no longer allowed to visit them. And it makes things much more complicated.
Thank you. The next question is for Chairman Thompson. You have served the Greater Houston community for over 40 years. Of course, you know this town more than a lot of other people. What do you think, what are Houstonians going through at this time, especially our students and kids? And what have you heard, and what do you want to know from them?
Well, this is COVID-19 is a big transition for everyone, particularly students. Number one, it came at a time where right in the middle of a semester, it changes the whole paradigm of how they learn, how to interact with their colleagues, extracurricular activity. Everything is kind of all changed around completely. It's about a 360-degree change. So this creates a lot of adjustments, and I must add some problems as well. How are we going to educate them? Of course, we've been looking at virtual learning for several years, since probably about 2005. How we can do this, for a myriad of reasons. Now here we're confronted with this sort of situation, and we're trying to figure out how we're going to be able to help them to learn over the internet, how we're going to graduate, how we're going to do graduations, how we're going to do proms, how we're going to prepare for tests to go into college, just a multitude of things. So it creates a big adjustments, and we have a big separation of students from their friends, their extracurricular activities, and it creates a big adjustment within our society. So I think we're all trying to find ways and means in which we can make the best adjustments for the largest number of people, particularly our students. And when you look at students with special needs, that is even a bigger problem because the demand and the needs of those students are so much greater than the normal or the average student that we consider in our public schools. So we have a big adjustment with our society to make, as well as how are we going to be able to not only address them today, but to be able to look forward and then address them into the future.
Thank you. I have another follow-up question. Your committee, the Public Health Committee of Texas House of Representatives, I think was the only committee which met to discuss the COVID-19 pandemic. So during those meetings, what were your key takeaway from that hearing in regards to kids and mental health? Was anything discussed about this special population of kids you were talking about, especially for Greater Houston area?
You know, one of the reasons why I held that meeting was the public was caught off guard, I should say, of a new situation, COVID-19. Had never heard of it. Didn't know how. We don't know how to treat it. There's no vaccines. There's no medical protocol. Just a myriad of things. I wanted, number one, to be able to get out as much information to the public so that they would know how to face this new challenge that they were seeing in the area of medicine. How are they going to be able to address this? And what I wanted to also know is how are the hospitals going to be able to take on the onslaught of people coming to their facilities for help, for treatment? Do they have the equipment? Do they have the personnel? And secondly, how are we going to be able to help our rural hospitals? And then what can our freestanding emergency room hospitals role can they play in it? What can the other clinics and things that we have within our community, how can they play into being able to help us address this particular issue? And what I found out that most of our hospitals are at a capacity of 95%. We're going to have a real shortage of beds if there's an uptick in the number of persons getting ill and having to go to the hospital. We don't have enough of the outpatient facilities that's going to be able to address this problem unless we move rapidly. But more importantly, I found during that hearing that we have a magnificent, huge shortage of PPEs, huge shortage of things that's so necessary for the person who are on the front line, our first responders, to be able to help the patients. They are not the proper equipment available. And number two, we're seeing a little bit of price gouging in some of these areas and being able to get those. So what I found out, we are really behind in being able to really fully address this problem if it really came full force. Now, one of the things that I think, like we're blessed in Harris County because we have Dr. Shaw, who has been able to manage situations like this before because of the Harvey situation and other disaster situations. So we kind of a little bit ahead, not very much, a little bit ahead of being able to prepare our citizens and being able to do those things that are so necessary for us to all to be able to stay healthy and to try to flatten that curve. But each person, during that hearing, I found out each person is responsible for not only trying to stay as healthy as they possibly can, but they have a responsibility of trying to help their neighbors stay healthy by staying away from them and by doing those things that they know that be safe for them to be able to survive.
Thank you. And you mentioned price gouging and PPEs. Are we doing anything for those people who are in this unfortunate time still price gouging, or to get more PPEs for our first responders?
The governor stepped up real quickly in that particular capacity, in that he has tasked the Attorney General with the task of being able to go after those particular persons. So I hope that I feel that he's going to aggressively go after that, because this is a very devastating situation where we have a person who's going to be off from work, in homes. The mental health situation is going to go up because we're not accustomed to being living inside of a family as as many hours of a day as we are being forced to do at this particular time. So that in itself is another challenge. That challenge our mental health area, not only who's already over challenged, but it adds another challenge to them. So I think the governor has moved real quickly on being able to address that price gouging.
Very good, thank you. Vice Chair Wu, question for you. Let's start by taking a moment to discuss a troubling trend we have witnessed in the past months. Been told by millionaires that they feel that your Twitter account is a fire for them. Although what we have seen is that your Twitter account has done a lot of awareness and a lot of awareness about important issues, whether it is discrimination against Asian Americans. What do you think about this particular situation and the Houston community has faced? Do you think our community is in some ways better than other communities? Are we doing more things to prevent any kind of discrimination, or are we the same?
It's hard for me to, granted, I'm very biased about the Houston area. I think the Houston area is always better than other places. But I really do think, because of the nature of Houston, because we're a younger city, or we stay here very long, because there's other people everywhere. The people from different races, different ethnicities, different religions, and people are just I think people are generally more tolerant. And that's not to say that there's not been issues. We just a day ago, we've had seizures. We don't know for sure that it's related to COVID-19, but there's some strong feelings about that. I think Houston itself is doing better than the rest of the nation, but it's really hard to gauge, because I think one of the big problems is many people in the Asian American community, when they have problems, when they get attacked, they tend to not say anything. They tend to, just live by the mantra of rock the boat, don't complain, and just go on. And, so it's really hard to gauge what's going on. And we've tried to make it very plain that we want to hear about those things, and we want to try to help address them. So, hopefully in the future, we as we go forward, that if there are more problems, that we will be able to address it.
Okay. Similar question, Chairwoman Sarah Davis. When you think about mental health, when you think about these kind of crises, do you think there is an uptick, or you anticipate any uptick? And do you think we need to be prepared for any kind of uptick in our population after these crises? Because we saw an uptick after Harvey, but what do you think after this crisis?
Yes, I anticipate that we will see an uptick in the need for behavioral health and mental health treatment. What I experienced after Harvey, there was a collective anxiety and feeling of loss for so many people. But because we were so immediately able to come together, creating apps where perfect strangers would come and muck out another stranger's house, that helped, I think, collectively for us to kind of come together. Of course, the Astros winning also was good for our mental health, I think, as Houstonians. But just for myself, basically for a full year, whenever it rained really hard and there was a significant amount of thunder, I would feel anxiety. And so I think that we're going to see more of that, because we just aren't able to experience the personal social connections that I think you help alleviate the stress that we feel as a community. And I know there's a lot of people communicating like through Zoom and through all these different technologies. And as we've experienced today, those present their own challenges. Mm-hmm. But I certainly anticipate that we are going to see a strain on our mental health safety net. And when we are able to realize that, largely is going to depend on when we're able to flatten that curve. Like, after Harvey, we were all there trying to help each other. Now, we almost view each other as a potential threat. And you see people hoarding toilet paper and hoarding food at the grocery stores. And so I feel like that lack of community feeling is really going to impact our children for sure.
Thank you. Next question is for Chairman Fallon. So during Harvey, we saw Chairman Fallon, Beaumont area was affected, actually affected a lot. So was East Texas. What do you think is the impact of COVID-19 on Beaumont and East Texas? And do you think the impact is similar here, or is it slightly different, or more or less? And do they have the facilities to deal with it?
Sure. Well, thank you, Dr. Shaw, and thank you, Mental Health of the Greater Houston area. I'm hiding in my son's bedroom right now. We're in the middle of homeschooling, so that's a challenge that we're trying to get around to educate 4 children at home while we're sheltering in place here. But yes, it's a little different out here in East Texas. We've always had a healthcare challenge, both physical and mental health challenges when it comes to our healthcare system. Our counties, the 6 counties in this region, banded together, have their own 6-county EOC to combat the COVID-19 crisis. Jefferson, Orange, Hardin, Jasper, Newton, and Tyler County have all come together to pool their resources because trying to do it on their own was just going to be too challenging. To date, we have just under 1,000 individuals that have been referred for testing, and we have 61 definite positive cases in those 6 counties. We know there's tremendously more out there, but we just have not had the testing capacity just yet. There's been 2 deaths that have been attributed to the virus, one in Hardin County and one just yesterday here in Beaumont. I actually knew the gentleman. I'm in commercial real estate. He actually was a longtime tenant of ours, but he passed away last night. But the information has been tremendous from our county judges and our mayors. The local government has done just an excellent job in really a crisis that no one's been prepared for. There's not really a playbook for something like this. I will say some unique challenges. We have seen a pretty significant decrease in mental health admissions to our mental health hospitals, mainly because to get referred there, you have to go through the emergency room. And no one wants to really go through an emergency room at any point in time, much less during a pandemic. So we're seeing a severe decrease in admissions for mental health reasons, and that's concerning. We also represent Orange County, which is the largest county in the state from a population basis that does not have a hospital. It closed in late 2014, and they've been working to get one reopened there ever since then. So you have about 90,000 individuals there without a hospital. And so, if you take in the other 4 counties from the north, they all have to come to Jefferson County for healthcare treatment, and there's not enough capacity at either hospital should this thing continue its course. And another unique is, challenge we have here in East Texas is that we border Louisiana, and Louisiana has had a real tough time getting control of this virus, and they're considered a hot spot, obviously. And the governor this week decided to shut down travel between the 2 states. It's a challenge because so many live and work in both communities, whether it's the industrial complex or it's it could be healthcare complexes. They go back and forth and they travel. So we immediately after that border was shut down, we had issues with the chemicals and the petrochemical and refining complexes. We also had child custody issues where parents lived across the border and had to get their child back due to a court order. So we're still trying to work around that. I don't know how long that's going to go on, but it seems like it's going to go on for at least another month. So yeah, it's a unique challenge being in East Texas, but I give props to our local government who I think really stepped up and done a tremendous job.
Thank you. And you all have mentioned so many great points. Of course, your challenge being next to Louisiana, the mental health challenge, or the challenges we are facing in psychiatric hospitals. I'm going to move our next segment towards school behavioral health infrastructure. And my first question would be, Chairman Gardner-Coleman. So Chairman, you have spent more than 2 decades at the Texas Capitol working to transform how public schools and the public school educators support kids in mental health needs. And for several sessions now, how educators support students in the aftermath of trauma and disaster. We've had numerous traumas, numerous disasters. We've had Santa Fe, we've had Harvey, now we have this. Why did you start on this initiative, and what are the positive signs you see in our community, in the lawmakers, in our state, based on all these initiatives, which have been great, actually?
Well, first of all, I think we've raised awareness, particularly about trauma in children, and how that has a longer term impact than just the actual event that has occurred. I think we also raised awareness among all the staff in schools, as well as teachers, that they unfortunately have to be part of our front line when it comes to children who are having emotional and psychiatric or mental health issues, and that we need them to be trained in order to refer those children back to their parents in order to get the help that they need, whether it be in a mass shooting or just in general everyday life. And I think that prepares us better for a circumstance like this. I know for some children, it's just a matter of the disruption in their lives in terms of trying to get used to doing schoolwork online or over the internet in this period of time that we're in, and doing it well. And then the idea that these circumstances are not, these circumstances are serious, and we want those students to have access to help from psychiatric and mental health providers during this time. And even though we really believe in telemedicine, it's not as widespread and easy as it sounds.
Thank you. And this is also very near and dear to me, because I know I was involved with Harvey, and the trauma after Harvey or even after Santa Fe or all these events is enormous in kids and even educators. Do you feel that educators in Texas have the training and resources to deal with this kind of aftermath, like especially after coronavirus outbreak? Because we saw that it was a tough challenge after Harvey. So what do you think now?
Not fully, and that's why we have to continue to train our educators.
Okay, and what movement would you like to see, and how do you think we can improve the policies related to school-based mental health? Because, these challenges continue to come in one form or the other. We had Harvey, we had Santa Fe, now we have this. So it would be a great idea for us to prepare our educators and others to deal with any kind of challenge.
Well, Chairman Coleman is excusing himself. I think probably one of the most important things that I see, having served on this a select committee to study mental health, is first of all an integrated approach to both primary and mental health at the same time. And then for school-based, obviously the health clinics like via Legacy are real game changers. So yes, we need to train the teachers for mental health, and we're allowing, non-licensed, non-physician mental health professionals to be employed by local mental health authorities and to work within the educational service centers with our schools. But I really think you have to couple this mental health or behavioral health with primary health. And I will say, because I will never not take the opportunity to advocate and to call attention to the fact that the health outcomes for children are largely connected to the mental and physical well-being of mother. And so if you really want to see the best mental and physical health outcomes, you really need to start before school. You need to start when at age 0 to 3, which I think most of the data will show that that's the key time for development. And we've been working a lot in the last couple of sessions on this very issue. We were able to expand Medicaid to allow women to receive postpartum depression screening and treatment for a full year after they give birth, because I really do believe healthy mommies, healthy babies. Another program that I think are really important and that the legislature has made significant investment in is the nurse-family partnerships, which are very intense relationships where nurses are going into the homes of women who are having their first child to really help them understand how to meet not only the physical but the psychological needs of their child. And so I think we are doing, and there's always the need to do more for our education-based mental health. But I also believe that it starts earlier than school, that these parents and these children really need to have intervention as soon as possible.
You're so right about that. Really, the early ages are the ages you talk about, less than 3, when the child is with the mother, and mother needs to be healthy. And again, I fully agree with the integrated behavioral health approach also. At Harris Health, where I am, and through Baylor, we have 24 clinics, and all of them are integrated. We have school-based clinics integrated, so I definitely understand the importance of that. So your committees...
Yeah, the Baylor Teen Health Clinics are just amazing, and I think that the Houston community is so lucky to have the Baylor Teen Health Clinics as a resource. They're just invaluable to our kids.
Thank you, thank you. And the clinics through Harris Health, which are school-based and others, are also doing an amazing job, so appreciate that. Also, your committee report emphasized the importance of educator training and also went further in terms of school-based recommendations. So aside from educator training in behavioral health, what school-based mental health support did you find effective, and have you seen legislative movement in those directions?
I remember in 2011, Chairman was pushing for more mental health evaluations in the schools, and it met with a lot of resistance. And now I think the legislature is really starting to understand the impact and the importance of having mental health resources available in schools. And so it's been my experience that data-driven policies are the ones that are the most successful. And when we were listening to the testimony, and Chairwoman Thompson, I know you were on the select committee, one of the things that struck us, or at least me, was the availability of mental health services is largely dependent on where you live. And so because of that, I think you've seen a more acceptance of having school-based mental health, because there are many counties that have no psychiatrists or psychologists whatsoever. And you also see, I think, more reliance and more acceptance on telemedicine. We're seeing that now for COVID-19, but I know that there are some pretty amazing programs. I know like a Dallas Children's Hospital has a great telemedicine program with certain elementary schools. And so you're seeing opportunities, and the legislature really being receptive to the advance in technology. And I just think, like Chairman Coleman mentioned, just the awareness and the acceptance of the whole concept of behavioral health and mental health. Because I remember a time when that subject was almost, taboo to even be discussed.
Thank you. Before I move on to Chairwoman Thompson, Chairman Coleman, do you want to add anything because you had to leave?
But no, I do believe all of those things apply. Telemedicine is extremely important, and we know it's efficacious in mental health circumstances. Know that for sure. We also know that children's mental health requires, as they say, a village, requires everyone, because children spend most of their time in school, and teachers and staff will see challenges there before maybe even parents because of our busy lifestyles. And then again, with COVID-19, whatever occurs normally in terms of interactions between siblings and parents and the like is going to be exacerbated, and often those are emotional and mental health circumstances that are put on, have extra fire put up underneath them. And that's something I think that'll be with us in terms of the trauma. Plus, we just don't know. We've never had since Spanish flu or since the other viruses, swine flu and the like. We've never had anything like this. And so we don't know the long-term impact that it has on our children and on just general mental health, because it's new territory. It's uncharted waters.
You're so true, Chairman Coleman. And of course, people who were sufferers of Spanish flu are not alive anymore because it was 1918, so it's been a while. Next question is from Chairman Thompson. In 2019, you passed a legislation to ensure that state spending on mental health in public schools have not only effective outcomes, but there is some accountability. We know that the task force is now up and running and it's going. How will the state ensure that all students in every school district have access to the supports and resources they need, and especially in this time of trauma and transition? What will be the plan?
Yes. One of the things we want to do, while we know that mental health and its outcomes are so important to our society, and we're putting monies into these various programs, we want to know whether or not the money is actually being utilized for the purpose in which it's being appropriated. And we want to know whether or not that we're getting the outcomes or the anticipated outcomes that we are funding. That's the reason why we have tasked the Texas Education Agency with the responsibility of being able to do this study. However, you know that COVID-19 has now interrupted their ability to be able to be actively pursuing this particular results. I'm hopeful that maybe we will have something when the session starts that will give us some indication of how effectively this money is being utilized. Now, in addition to that, while we're talking about it, one of the things you notice, I filed a bill on studying the brain, and I think that this is a very significant, you're laughing, but I'm going to run with that bill again. This is a very, very significant piece of legislation, because I believe the more we learn about the human brain, and the more we learn about the targets that does different things to the human brain, we're better able to address those issues, develop protocols and treatments for persons and individuals to better assist them in what we call living a normal life.
Thank you. And you know, because of those efforts, there was a task force created, and MHA is chairing a task force, and I'm the chair of that, so I'm really appreciative of all the efforts. I'm going to move now to supporting traumatized communities, what we all can do. And, you know, we have learned from Harvey, we have learned from others that communities get traumatized. And Harvey was a 1-day or 2-day event, but this is a longer event, and we don't even know how long this is going to last. So my next question would be for Chairman Fallon, that what do you think your community, I know, was the hardest hit during Harvey? And in the months following the storm, you were very involved, you were on the ground. What do you think, what lessons did you learn which you would like to use today for today's response? Because I know that because of your community involvement that time, it was very significant. So what do you think, what lessons were learned which can be applied today?
Well, I learned that was that's the easy part, the on-the-ground response directly after a natural disaster. That's really the easy part, believe it or not. You know, everyone wants to get involved, everyone wants to donate, and that to me, the grassroots boots on the ground is easy. The hard part is months down the road, years down the road. And so I have a district that was severely impacted by Harvey, and then Imelda 2 years later, and then 6 months after Imelda, we had a plant explosion that was very significant in this community. It was the day before Thanksgiving. So it's constant, it seems like. And so that's 2.5 years of trauma especially for our youth. And I've learned it's very non-discriminatory. It affects everyone. It doesn't care about race or religion or income. Everybody will be impacted. But I've noticed that the most vulnerable populations are the ones that are impacted far longer. They just don't have the network and the safety net to recover, to bounce back. And I look at how much education and how much these children have missed school. And school is so vital. Our public education system is so vital to these vulnerable populations. It's their social interaction. It may be the only meals they get that day. Their teachers are so important to their daily lives. And none of that's there right now. And we're seeing a sharp increase in domestic violence in Southeast Texas. And I don't, some of these children don't have internet. So the social, the distance learning is not even an option. I don't know how they're going to make up this time. They're going to have to get very creative. But all those mental health safety nets for our vulnerable children, the nonprofits, pastors, relatives who they can't be around right now, state agencies, they're just not there. And it's going to take a while to put it all back together. I would tell, anyone in my community, if you want to get involved in the mental health space, especially with our children, is support these nonprofits, because these very uncertain economic times, just like after a hurricane or just like after any other natural disaster, the nonprofits suffer. And I think they're especially going to suffer this time. So your places like your CASAs and you look at, we have some mental health counseling facilities here in Southeast Texas that are nonprofits, and they fill a vital role. And they, like everyone else, and I'm sure it's happened all over Houston, everyone's had to cancel their spring and summer fundraisers, which could basically be half their budget. They're going to have a tremendous caseload after this. So the state budget's going to be tight, and I think if you want to get involved, support those nonprofits. It's difficult to get involved in that space. It's easy to donate water or clothes after a storm, but 6 months, 8 months, a year down the road, when these mental health issues really start to surface, that's when we need these nonprofits the most.
Thank you. Next question is for Congressman Jean Wu. The question is, what can communities do to help each other or help kids in situations like that? And especially in the months to come, what would be some advice or some things you would like to share?
I think for a lot of us, not just complete introverts, the hardest part of this, outside of the medical crisis or employment, is social isolation. Not just that we can only talk to our family, immediate family and people, but that we're separated from other human beings that we need for daily interaction. We forget about how important that is. That we're able to talk to other people's ideas for me, I'm sort of halfway introvert, extrovert, but even for me, I miss being able to go grab a beer with people or to hang out with people after work. I miss people from work. So I think we need to check up on each other. I think that's the biggest thing, that we should get together as much as possible, use technology whenever possible. Even whatever, to share each other's pain and to let each other know that that we're there with you, that we're going through this together and you're not alone. I think that depression in this will be a very significant factor. I think for this period of time, that for people who lost jobs, people who are isolated, people who are going to, when they're watching TV, they're going to see the body counts. They're going to see the daily death tolls rise and rise and rise. And for them, this may be like one thing piled on top of another. So please check up on everyone. Check up on your friends, check on your family. Keep talking to them. Don't just say, hey, are you okay? And if they say yes, ask them, tell me what's okay. Do the basic surface level stuff. Actually go and actually dig in deep and see how they're doing as a person.
Thank you. My next question is for Chairwoman Sarah Davis. And my question is that the economic implications of this coronavirus outbreaks are, of course, staggering. Obviously, unemployment is already on the rise, and the need for kids and teens are increasing, and there's a dramatic drop in oil prices. With all what is happening and what we are seeing, what do you think that Texas legislature can do through our governor to prioritize children's mental health? Because of course, these are very strange times, but very demanding times and very stressful times.
Yes, that's an excellent question, and it's a cause of concern for everyone, I'm sure, that serves on the Appropriations Committee. As chair of Article 2, I have this heightened sensitivity to it because, just when we were writing the budget for fiscal year 2021, we assumed that the price of a barrel of oil was going to be $52 or $53 a barrel. So not only are we looking at a very bad budget cycle in 2021, we are going to have to do, I would think, a pretty significant supplemental as soon as we get back into 2021, kind of to backfill the holes that we're going to experience. And in terms of funding for mental health, I think that the state has been increasing the amount of funds for mental health. In the past legislature, we appropriated $283 million in new funds to address capacity demands for behavioral health services. And part of that was an increase in the provider rates for providers that treat pregnant women and women with children with substance abuse disorder. We were really focusing on that population because, again, the health of child is so linked to the health of mom. But if you're an advocate and you are trying to figure out how to engage with the legislature, the first thing that I would realize is that you need to become a stakeholder or engage in discussions with the Texas Health and Human Services Commission as it works to implement the transition plan for the 1115 DSRIP project, because that is a project that is scheduled to wind down in 2021. That's a loss of billions of dollars. And more than half of the DSRIP projects are mental health. And a large portion of those are for children, for mental health programs for children. And so there's a rider in the budget, Rider 38, that directs HHSC to evaluate the costs and savings and outcomes for all the different DSRIP projects that are around the state. And I can assure you that that report is going to be what guides the legislature in determining which of those programs it's going to fund with general revenue dollars, because we will be losing the federal dollars, assuming we have the general revenue dollars for that, and assuming that the 1115 waiver is somehow not extended. So I would say if you want to be an advocate, I would really try to engage with HHSC. I would send emails to your legislators, letting them know what your particular priority is. Phone calls right now might not be the best because I know all of our staffs are working remotely from their cell phones. But you really need to engage with the state reps and the state senators. We can't forget about the Senate, although sometimes I'd like to. But yeah, you really just need to engage But I'm particularly focused on all of these district funding that we potentially will be losing.
Thank you. And district is very near and dear to me because I know there's so many programs which are running because of that. Also, you mentioned pregnant women and opioid, and we have that mom grant, which is also very near and dear to us and being in enhanced health. So thank you for mentioning that. Nobody would have summarized it better than what you did. Next question is for Chairman Coleman. And the question is that earlier in the conversation, we discussed your role in creating a school-based support system for students across Texas. You also serve as a chair of the House of Representatives County Affairs Committee. In that role, where do you begin when guiding Texas counties to craft a response when it comes to events like Harvey and now coronavirus?
First of all, counties are the system for mental health in our state, particularly for people who do not have insurance, and even for those with insurance, because there is an infrastructure there. What we try to do is get the sheriffs, the centers for mental health around the state, and the community, which through organizations like the councils of government, to work together to deal with both crisis situations for children, families, and adults, but also we're working with community collaboratives and trying to get counties involved in that in order to expand the availability of mental health treatment and care for families. So not just adults, but also children, and outpatient treatment for those very same children and also adults, but also to expand the number of beds available for acute care, psychiatric treatment for families who are in need. We just have not had enough. And as Chairwoman Davis has said, we put more money into this and we've made progress, but we are clearly, I've worked a lot on DSRIP as well and on the 1115 waiver. We clearly went up by $1.5 billion, but we go down by $1.5 billion in mental health. And so we have to keep moving forward with our school-based health determination in terms of need in mental health to get people to the resources that we have. It does nothing to have resources if we can't get people, and particularly children, to them.
Thank you. I have two more questions and then we're going to come towards the end of our discussion. But before the end, I would ask everybody to have maybe a 1-minute closing statement. So my second last question is for Vice Chair Jean Wu. Congressman Wu, you are a champion of juveniles who are incarcerated within Texas juvenile system. What can you tell us about the incarcerated juveniles? How are they staying healthy? And what are the detention centers and state schools and facilities doing for
that? So right now what's going on is TJD, the agency that handles kids in prison, is following about the same rules as CDCJ, the adult prisons. And what they're doing mainly, one, cutting off family visitations, which is very hard, especially for kids. The kids get very few visits in the first place because most of the units are many, many hours away in the first place. And the second thing they're doing is they're taking more elaborate isolation steps to prevent staff who are coming in to contaminate kids. And the same concerns that we have for adults in prison, we have for kids in prison. And I want to be able to say that the situation is okay, but it's not. And it's still a small confined population that really has no ability to isolate and distance themselves from other people. If a caregiver or a worker comes in with COVID-19 and spreads around, it's going to be bad. Fortunately, I think I think the kids in juvenile in juvenile custody will have a little bit better care than their adult counterparts because there are fewer kids and they have better services and better facilities. For local kids who are locked up, what the juvenile judges have been trying to do is to release as many of them to go home with their parents during this time as possible. A lot of the concerns that we would have about their safe release is now mitigated by the fact that, well, no one's supposed to be going out in the first place. Everyone's supposed to be at home. Everyone's supposed to be quarantined and stay at home. So as long as I think the judges feel like the kids will stay at home and not leave and not go cause other problems, you can be in jail and be in jail at home, and everyone chooses to be in jail at home. So in terms of mental health care, the system is moving towards more of a trauma-informed care and working on that there. But for right now, I think for COVID-19, dealing with it, for kids in custody, the system's doing as best they can. They're trying to release who they can release. But for the most part, it's just they're going to do their best to keep the virus from spreading through the system, because once it's in, it's going to be hard to control.
Thank you. Thank you. Chairwoman Thompson, the next question is for you. You lead Houston's Democratic House delegation. What do you think can be done in this situation, and how do we start, where do we start to help kids?
Well, we really started the wound almost. I think it's very important that we have a very good, safe environment for children. And in order to have a safe environment, you have to have a good home environment. And there are so many things about the home that we are learning about now. And we're talking in the area, if I just isolate and talk in the area of mental health, we recognize that we cannot treat a child who may be suffering from some mental health condition in a vacuum or a silo. But it has to be an integrated approach, because it has to include the family as well as the community. And one of the things that we can do is to make sure that we have a good, healthy environment for the child, for the family, and in addition to that, a safe environment, good schools, and those things that perpetuate a healthy lifestyle. I think those things are so significant for children to be able to survive and thrive and learn within our society.
Thank you very much. Now it is time for a closing statement from all of you, 60 seconds. I will start with Congressman Fallon. Congressman.
Thank you. I appreciate you. Thank you all for doing this, putting this together. I just want to say I look forward to working with all the stakeholders next session, MHA and Legacy and my colleagues here on this call, and look forward to continuing our work on mental health. It never ends. I will say I thought we did some excellent work post-Harvey, but I also think we had a lot of time to work on it, and we had the budget to, I think, provide the resources for our local communities to be more resilient. How we do that with this particular pandemic, I don't know. The time frame is going to be much shorter. The budget, as Chair Davis said, is going to be very difficult. And, I think that as we try to get our arms around the budget and priorities, I think it's about empowering our local nonprofits, our local mental health providers, and it should be a difficult session. We have redistricting coming up, and on top of all this is a reminder to go do your census, which it only takes about 10 minutes to do. So all those listening to this, please go fill out your census while you have time at home to do so. So again, I just appreciate this opportunity to discuss this issue, and I, again, look forward to working with you all next session.
Thank you. Chairman Coleman.
Well, I share that same sentiment that this is timely. And it actually brings more questions than answers at this moment because we've never been through anything like this. One of the reasons why I worked on mental health issues for children, I've been through many of the same challenges. I had bipolar disorder, and it started when I was manifesting itself when I was in high school. But we have a lot of kids who weren't getting access to treatment because of whatever mental illness they may have had or may have. And I think we brought through this last couple of decades of looking at identifying mental health and emotional health challenges and behavioral health challenges and students actually focusing in on them and having them have the ability to work with their parents in order to get the treatment that they need. I think trauma-informed care has become extremely important because we didn't realize how much the trauma of a COVID-19 or a Harvey or something occurring in the household was having an impact on our children's ability to succeed into the future. And this is something that we have to continue to work on. It is not inexpensive, but it's worth it because it is about the strength of our overall community when we're talking about our children. So thank you for including me in this town hall and in this presentation. And may we all succeed in our goals of moving through COVID-19.
Thank you. Chairwoman Sarah Davis.
All right, well, thank you, Dr. Shaw, and thank you to Children at Risk and Legacy and Mental Health America for bringing us all together. You have Republicans and Democrats, and you have, members who have significant amounts of seniority and some of us with less. So I think it's really always a good conversation to have so many, different perspectives, but it also kind of really, I think, shows the unity that we're feeling as state representatives. Harvey affected one part of Texas, and there was a lot of concern going into session if the rest of our colleagues would remember what happened to the Gulf Coast after Harvey, and we were so overwhelmed that they did. And we were able to do a lot of really great things for the state. But this is an issue that affects everyone, and it's statewide, and it's the first time I've ever faced as ever in my life, like a public health pandemic. And one thing it's really shown me is how very fractured our healthcare system is. I mean, I've known that, and serving as chair of Article 2, I've become more and more aware of it, but you just really cannot ignore how fractured healthcare is in this state. Whether you're insured or not. And I've urged the governor to do an emergency expansion of Medicaid while we are experiencing this public health disaster. But I do think, as an all Texans, we have a positive outlook, and we will get through this together, and we will learn lessons over the next couple months that will help guide us in the next legislative session. And it's just a real huge honor to be here and to get to serve with some of the amazing folks that are on your panel. So thank you so much for having me.
Thank you. Vice Chair Wu, your 1 minute last.
So, we have very immediate health concerns right now by just taking care of the people who are sick and trying not to get sick ourselves and try to contain and flatten the curve. But I think mental health is something that's going to be very important going on afterwards in the next few months, because I think a lot of people who live through this are going to have serious trauma from this. And I think a lot of people who have dealt with the isolation, who have had family members get sick and watched them get sick, or they got sick themselves, it's going to be a traumatic event for them. And I don't know what the result is going to be, but I know they're going to be hurt, and some of the hurt that they will have is going to be long term. It's going to be inside them and not just the physical. And I hope that as a state we can move forward to address mental health as a whole, as a serious medical condition, and not just as something that only weird people have. And we have this hope every session that we can do more and more and more each session to address this, and just help people be people.
Thank you. And Chairwoman Thompson, your last thoughts to close this panel discussion?
Well, this has been a very excellent opportunity for all of us to be able to weigh in on the issues that are facing us, COVID-19, to look more aggressively at the mental health situation that we have within our state, and to look forward to what we're going to be able to do, hopefully in the future when the legislature start up. We know no matter what the budget may look like, there are some co-issues and some key issues that we're going to have to take care of. And I think that our colleagues, not just the ones that are appearing on your program today, are going to be attuned to trying to address those issues. And I want to just thank all of you just for the opportunity to be able to express our commitment and to be able to talk about a subject that is so significant and important to all of our constituents. Thank you very much for this marvelous opportunity.
Thank you. And at this time, I would like to take the opportunity to thank our esteemed guests, Chairwoman Sarah Davis, Vice Chair Jean Wu, Chairman Fallon, Chairwoman Thompson, and Chairman Gardner Coleman. This is a time when unity is most important, as Chairwoman Sarah Davis said. As you saw here, we have Republicans, we have Democrats, we have people from both aisles. Why? Because we all care. Care is the common theme. We want to be united at this time. We want to do things this time. And this time also, I would like for people to know that we need to do few things to cope during this crisis. We can eat healthy, we can exercise, we can sleep well. We need to avoid substances, alcohols. We need to connect with each other. We need to remember social distancing does not mean social isolation. We are connected socially with each other right now, but we are distant. So we can use these methods or other ways to connect with each other. Social distancing never means social isolation. It doesn't mean social isolation. We can be connected. Media overload, we blame everything on media, but it's also our responsibility that if we are amongst those sensitive people who cannot handle media, nobody's forcing us to watch media. We can take a break. We just need to watch a little bit of media, maybe not all of it. And again, if somebody is suffering, this is time for us to seek help. We also need to be optimistic here. People look at their 401ks, people look at everything and they're losing things and unemployment. We need to be optimistic. This is a great country. This is the best country in the world. We can come out of this. We have come out of this before with Spanish flu, with other crises. We will come out of this. It is just a matter of time. We need to think about the future. Tomorrow is another day. And lastly, we all don't need to forget about first responders, physicians, nurses who are at the front line. Thank you very much. It has been a pleasure.
Thank you.
Thank you. Thanks all. You guys were awesome. Thank you.
Okay, bye guys.
Thank you.
Thank you all.